In this episode, Dr. Robert Gabbay, Chief Scientific and Medical Officer of the American Diabetes Association, speaks with us about major highlights from this year's Scientific Sessions Conference. He'll discuss new preventative drugs and devices for diabetes patients and how much progress has been made in the path towards a cure. Later, we'll explain how some popular painkillers may pose a risk for patients with type 2 diabetes, and debunk several popular myths about diabetes care and prevention.
COVID-19 patients face an increased risk of developing heart disease and diabetes, especially in the first 3 months after infection, a new study finds. Scientists reviewed the medical records of nearly 1 million people. Half had contracted the virus, while the others had not. The results showed those in the COVID group had 81% more diabetes diagnosis in the first 4 weeks after infection, and their risk was elevated by 27% for up to 12 weeks. COVID patients were also 6 times more likely to develop heart disease, mainly caused by blood clots in the lungs and irregular heartbeat. The risk of new heart disease started to decline at the 5-week mark and returned to normal within 12 weeks to 1 year. One author says, "It is clear that particular vigilance is required for at least the first 3 months after COVID-19. He and his co-authors say doctors should advise their patients to reduce their risk through a healthy diet and exercise." Girls with type 2 diabetes may be at increased risk for ovarian cysts, according to a new study. Researchers reviewed 6 published investigations involving 470 girls with type 2 diabetes. They found that nearly 1 out of 5 of the participants had polycystic ovary syndrome, or PCOS. That's a substantially higher rate than in the general adolescent population. PCOS is a hormonal disorder that causes fluid-filled cysts on the ovaries, resulting in irregular periods, acne, excess hair growth, and obesity. The condition is also associated with high blood pressure, high cholesterol, mental health conditions, and infertility. The authors say it is critical that active screening for PCOS in girls with type 2 diabetes is initiated at diabetes diagnosis. They say future studies are urgently needed to help develop personalized treatment strategies.
Hello and welcome to Health Day Now. I'm Mabel Zhang. The American Diabetes Association concluded its annual conference, its 82nd Scientific Sessions. We're joined now by Dr. Robert Gabbay, the ADA's Chief Scientific and Medical Officer, who will discuss highlights from the meeting, including new drugs and devices, the relationship between diabetes and COVID-19, and how much progress has been made in the path towards a cure. Welcome, Dr. Gabbay.
Thank you.
So great to see you again. Now tell me, what were some of the highlights from this year's meeting?
Wow, there was a lot. We literally had hundreds of presentations, 1,000 posters, and so lots of new information. As far as the science goes, there are new therapeutics, and I think one of the most exciting things there is a new treatment called tirzepatide that was a study that was presented here and published in the New England Journal of Medicine simultaneously, that demonstrated a pretty profound weight loss in people actually without diabetes. The weight loss was 22%. So the average weight loss for the people in the study was 49 pounds. What's really exciting about it is that we really haven't had therapies that have that significant effect. This is the type of effect that we might expect normally only with surgery. And so to be able to get these kind of results through a once weekly injection is of great value to people with diabetes in particular, and those without, since obesity is so pervasive in this country and around the world.
Can you talk a little bit about the SURPASS trial, which did show some beneficial effects on kidney outcomes?
Yes, so one of the big questions around this class of drugs that is a combination of sort of 2 hormone effects, one something called GLP-1, glucagon-like peptide 1, and we already have a number of medicines that work in that way. And so it has that effect, plus this other hormone, gastroinhibitory polypeptide, GIP. So it is a dual hormone action. And what we don't know about it is that whether it maintains all of the benefits of that GLP-1 type of drugs, and specifically those drugs can reduce the risk of kidney disease and cardiovascular disease. And so it was important to see when you do this combined therapy, is it still protective of the kidneys? And the data that was presented suggested that, yes, it does have that benefit for the kidney. And the next big question is going to be, and these studies are ongoing, will it also have the beneficial effects on lowering the risk of heart disease as well? So stay tuned for that one.
What about the relationship between diabetes and long COVID? What did we learn this past year?
Yeah, sobering news. So not only were people with diabetes disproportionately impacted by COVID, with as many as 40% of all the deaths in the US from COVID being in people with diabetes. Now what we're finding is that, and was reported here, that people with diabetes are at significantly higher risk of developing symptoms of long COVID or post-acute COVID syndrome. This is really the first set of reports that I've seen that are documenting this, and now I'm sure many investigators will be looking at this. Part of the challenge has been having a consistent definition of what is long COVID, so that investigators can use that definition and look at large groups of people to figure out what the risks are and why, and what we can do about it, which is the most important part.
Some 10 million people in the US need insulin to manage their diabetes, and without it, they could die. Yet the cost of the drug is skyrocketing. Why?
Well, it's a complicated set of reasons. I think where the American Diabetes Association has leaned in very strongly is around ensuring that there is access for all. It really should be a right for all people to have access to insulin. And so we've been working state by state, having passed legislation in 21 states, most recently here in Louisiana, capping the costs of insulin, and working at the federal level with a bill that has already passed the House and now is pending a vote in the Senate. And so we're hopeful that insulin can be more affordable for people with diabetes, so that they certainly can have access to life-sustaining therapy.
There were quite a number of presentations on insulin delivery systems. What are the latest advancements?
Well, that's been a wonderful progression of treatment options that really can not only get better glucose control, but also reduce the burden of diabetes for people. And in particular, the different devices that use automated insulin delivery that take information from a continuous glucose monitor and use that to tell insulin infusion pump how much insulin to give. And it's sort of a step towards an autopilot, although we're not there yet. There's more progress in that direction. For example, they're very good at adjusting glucose levels overnight. And normalizing those levels overnight. But with meals, they're still dependent on estimating the number of grams of carbohydrates someone eats and figuring out sensitivity and a number of other factors. So that part is not autopiloted as of yet, and that's an area that people are working on. In addition, having different types of devices to do this, pumps that can live on the body and not require any tubing, is another potential advantage for some people that would prefer that type of insulin pump to some of the others.
We saw from the meeting that there is a connection between obesity and type 1. Previously, we knew a lot about obesity and type 2, but this seems very significant, what we heard out of the meeting.
Absolutely. So, one of the things that we're realizing, both in children and adults, is that, we tend to think of type 1 diabetes as people being thin and type 2 diabetes as people having obesity. And more than a third of people with type 1 diabetes now have obesity as well. And so all of the additional risk factors for complications, cardiovascular disease that go with obesity are just compounding the issues related to having type 1 diabetes.
What are the research areas you're most excited and optimistic about?
Well, I think one area is around this concept of diabetes remission, that people with type 2 diabetes can be treated in a variety of ways that could lead them to be in remission, meaning not needing any medications to maintain good blood glucose control. And so that, with the tools that we have available now, that is becoming a more realistic option. And I think we'll see a lot more research on that in the very near future. I think the other area that continues to be exciting is the march towards finding a cure around type 1 diabetes. And there were studies reported here that demonstrated islet cell transplantation, seeing and beta cell transplantation showing real benefit and potentially the opportunity to for people with type 1 diabetes to not need insulin therapy. And again, more work needs to be done, but there's still there's a nice movement in the right direction. And so excited to see that work continue.
All right, Dr. Gabbay, thanks so much for sharing all of that. It's great to see you.
Great to see you. Thank you so much.
I've been speaking with Dr. Robert Gabbay, Chief Scientific and Medical Officer for the American Diabetes Association. And I'm Mabel Zhang for Health Day Now.
Certain non-steroidal anti-inflammatory drugs may increase the risk of heart failure in people with diabetes, a new study finds. NSAIDs are popular medicines used to relieve pain, reduce fever, and lower inflammation. But researchers say potential side effects like fluid retention may impact the heart health of patients with type 2 diabetes. They monitored more than 330,000 patients with type 2 diabetes for an average of nearly 6 years and found participants 65 years of age and older who were prescribed ibuprofen or diclofenac were significantly more likely to be hospitalized for heart failure. The strongest association was found in those who were infrequent or new users of NSAIDs. The lead author says, "We always recommend that patients consult their doctor before starting new medication, and with results from this study, we hope to help doctors mitigate risk if prescribing NSAIDs." The study did not include over-the-counter NSAIDs. Taking vitamin D supplements may not help prevent type 2 diabetes, according to a new study. Researchers say weight loss and exercise are still the best way to lower your risk of the disease. They recruited more than 1,200 Japanese adults with pre-diabetes and randomly assigned them to take either a drug used to treat vitamin D deficiency or a placebo. After 3 years of monitoring, no meaningful differences were found between the two groups. 12.5% of those who received the drug developed type 2 diabetes, compared to 14% of those who took the placebo. The number of patients whose blood sugar levels returned to normal was also similar. However, after adjusting for factors such as age, sex, blood pressure, BMI, and family history, the results suggested vitamin D might help pre-diabetic patients with insufficient insulin secretion. The author of an accompanying editorial says these findings are consistent with other recent trials, but more research is needed to investigate different dosage levels and treatment durations. Until then, she suggests healthcare professionals should continue to discuss with patients the musculoskeletal health benefits of vitamin D and support them to achieve and maintain lifestyle changes that are known to decrease development of type 2 diabetes.